Good morning, committee members. My name is Tyler Downey. I serve as the Secretary-Treasurer of SEIU Healthcare, and I'm joined by SEIU's Director of Government Relations, Michael Spitale. The Service Employees International Union represents 2 million members across the United States, Puerto Rico, and Canada. In Ontario, SEIU Healthcare proudly represents 60,000 workers on the front line of care. Our vast jurisdictional representation is relevant because our members on the front line know firsthand the best of what a system represents, as well as the risks. Erica Watanabe, a certified surgical technician who works for America's largest hospital conglomerate, tells us of the failure of HCA Healthcare, a $72 billion corporation that pays out nearly $700 million in cash dividends to shareholders every year, refuses to invest its massive resources in safe staffing to guarantee dignified care at her hospital in Nevada. Erica is overworked, burnt out, and is experiencing depression over the ugly experience of her patients. The for-profit hospital chooses to understaff shifts to maximize its profits. Prioritizing profits is what corporations exist to do. I know that Ontario can do better than open the doors to for-profit American healthcare corporations. SEIU wants Ontario's healthcare system to succeed in delivering quality care. We believe that we share the mission with all the members of this committee. That can only happen when our healthcare workers are supported. But in Ontario, healthcare workers are not supported. And healthcare unions representing over 300,000 workers on the front line of care are telling this government that Bill 60 is more risk than reward. Part of our job as a union is to amplify the voices of our members. Members like Briar Moore, a registered practical nurse from Niagara. She works on the inpatient oncology floor where staffing ratios for her cancer patients should be 4-to-1, but are more often only half staffed with ratios reaching 7-to-1 or greater. Emotional care for her cancer patients is an impossibility under current staffing conditions. She told me of a sweet elderly woman receiving chemotherapy coming to her floor with blood on her gown, smelling like sweat and her hair in a tangled mess. And her response, Briar's shocked face, "Oh, the poor nurses are running around. They don't have time to do this kind of stuff. My daughter will be in later and she will help me, but she couldn't come yesterday." Let me repeat, an elderly mother being treated for cancer, covered in sweat, her gown stained with blood, her hair tangled for days, going through hell right here in Ontario, in Canada. Without proper hygiene or human dignity because staffing ratios were nearly half of what it should be. Dangerously low staffing levels, poor conditions of work, and inhumane care delivery are driving nurses like Briar to the breaking point mentally. In the American system, staff and patients are shortchanged to maximize profits. In Ontario, staff and patients are shortchanged due to a lack of public investment. Meanwhile, Bill 60 will not add a single new healthcare worker into the system. And that is the fundamental problem with Bill 60, as a blueprint for business interests that put profit before patients. It does more to funnel care into a private system where big investor-led corporations can profit than it does to support abandoned staff in the public system, like RPNs like Briar. I urge you not to dismiss healthcare workers crying out with warnings from the front line because there is nothing wrong with our public healthcare system that can't be fixed with what's right about our public healthcare system. I'll now turn it over to Michael Spitale for more on the healthcare staffing shortage.
We often say at SEIU that our members are the people on the front line of care. The reality of our system today is that we don't have enough people to provide care. And what Tyler described is staff who can't safely keep up with what we ask of them. There is a direct correlation between access to quality of care and the level of healthcare staff. The Nonpartisan Independent Financial Accountability Office of Ontario recently said the following about the healthcare system. It's not necessarily that there are no beds, but there are no staff for those beds. He went on, we think they're going to have trouble, not building the beds, but staffing the beds. The volume of folks going into ER is actually lower, yet they're waiting longer. That's a staffing issue, he said. If everything the government intends goes to plan, the healthcare system will be short 33,000 nurses and PSWs in 5 years. Finally, the FAO report from March of 2023 reads, increases in capacity will be more than offset by increases in demand for the services from Ontario's growing and aging population. Relative to projected growth in demand by 2027, 2028, Ontario will have less hospital capacity, similar home care capacity, and less long-term care capacity compared to what it had in 2019. The conclusion is that healthcare will be worse in 2028 than it was in 2018. Now, SEIU does come with solutions. Number one, send a positive signal to healthcare workers and don't fight them in court over Bill 124 or attempts to deny them the pay equity they've already won in court. Number two,
45 seconds left.
Thank you. Create sectoral bargaining tables with government as a partner to pay healthcare workers equal wages across sectors for the same work. Number three, raise the wages for all nurses, starting with an immediate $35 minimum wage for registered practical nurses. Four, fully fund healthcare so wait times can be addressed in already unoccupied trusted public hospitals. And finally, learn from the disaster of long-term care and do not turn the keys to hospital services over to the same kinds of big corporations that delivered substandard care as a business model for shareholders. Thank you for your time.